Oh. Okay, good evening everybody. My name is Farrant. I'm the Chief Executive of Bournemouth, Christchurch and Poole Council. I'm joined this evening by a number of colleagues, and we want to talk to you about where we are on COVID at the moment, the situation here in the Bournemouth, Christchurch and Poole area. So I'm joined by Rachel Partridge. Rachel works for Public Health Dorset and works across both Bournemouth, Christchurch and Poole and across the Dorset area as well. Councillor Nicola Greene. Nicola is the portfolio holder for COVID resilience and public health for Bournemouth, Christchurch and Poole Council, and Wayne Nock from Dorset Police. So we're doing a live briefing really to bring you up to date with the position here in the Bournemouth, Christchurch and Poole area. Before we get into the detail, I really wanted to start with a bit of reflection on the last 8 months. We've had a huge amount of effort across the whole of the public sector, probably since February, as we've been looking at the growing global pandemic, and we've put some really strong efforts on protecting people and supporting our area to be able to bounce back from the COVID pandemic when we can. We'll talk to you this evening. We'll talk about how we've launched a community support response from scratch, Together We Can, where we've had over 2,000 volunteers. We've supported many people that have been shielding and vulnerable with help, advice, food, prescriptions and companionship. We've had a fantastic response to our call for volunteers, and we want to thank everybody that's taken part in that. We've supported care homes to get personal protective equipment, PPE, if you remember the big debates about that during the summer when there was difficulty getting access to that. As a council, we've processed nearly £1.3 billion of support to local businesses, including £84 million of grants, £369 million of loans have been processed to keep our economy going, and reductions in business rates, etc. And early in the summer, we housed almost every homeless person in the area during the height of the pandemic. So a really strong public sector support to our communities. And perhaps most importantly, we try to keep you informed on our website, via email and social media. And I would encourage you to sign up to our emails as soon as this broadcast is finished. Just go to the BCP Council website, which is bcpcouncil.gov.uk, and there's a sign up to information. We send out regular emails, sometimes daily, a number each week, and that'll keep you updated. We've had over 30,000 residents already subscribe. So a lot going on, a lot to tell you about. At this point, I'm going to hand over to Rachel Partridge from Public Health Dorset to give us a bit of the context around public health. Rachel.
Thank you. Hello, yes, I'm Rachel Partridge. I'm Deputy Director of Public Health at BCP Council and Dorset Council. You'll be pleased to hear that as part of the ongoing response to COVID, we're really keen to keep our residents and colleagues really up to date with the situation. So this briefing absolutely adds into the weekly updates that we have been doing and will continue to do. You'll be pleased to hear that I've kept the slides to a minimum this evening, but just to give the very clear update of where we are in terms of case rates for the BCP area in the latest 7-day period. As you can see, there's very stark and visual representation of what's happening with our case rates. This is the number of tests. So in the 7 days prior to the 24th of October, we had almost 800 positive test results over that previous 7-day period. I'm conscious that the 24th of October sounds like a long time ago. That's simply the data that we're using to present, because the number of test results and the national system, there is a bit of a time delay and volatility in the last few days, but just to rest assured that we're keeping a very, very close watch on a daily basis on background information as well. But I think it's clear here that we are in a situation where over the past 7 days we've seen a significant increase in the number of people that are testing positive in the BCP area. The other line, the red line, is the Dorset Council area. I'm conscious that we share very close geography. Partly that could be seen positive in the fact that we've got much better access to testing than we've ever had before. There's increased capacity and availability of testing via the Department of Health Creekmore site and 2 new additional mobile testing units that are available within the BCP area. So there's definitely increased testing and availability, but certainly a significant increase in the number of cases, which is of significant worry. the next slide will show our incident rate. So this is the number of people that have, number of cases per 100,000 population, and we've put some comparisons. Again, it's up until the 24th of October. It's that 7-day period, and we've put some comparisons with our neighbouring area. Again, BCP Council is showing to be 196 people of cases per 100,000. I've checked the data that's coming through live, which is today, and we're around 200 cases per 100,000. Again, there's volatility in the data, but I just wanted to give that clarity that we are seeing that we are at a significant rate of infection. To put that in context, we are aware of what's driving a lot of those cases, and we have got some ongoing situations in key settings. We see the most growth in cases coming from household spreads, so transmission to people that will live within the same household, and also quite a large amount of transmission happening between friends or family groups. There's also the ongoing testing that we have, the routine testing of all care sector staff on a weekly basis, which again is identifying cases. Quite often that's asymptomatic. These are people that are showing no signs of illness, and actually that is a really important mechanism and really protective thing that we have instituted. It is showing as a positive case, but I think it's very positive that they are picked up and self-isolate rapidly, so again to protect our most vulnerable. We have also seen cases linked to schools, but again the outbreaks are managed very well and contained, but we are seeing cases from contacts within that setting. So generally speaking, increased activity, and we're reviewing really closely and constantly reflecting on what additional measures we can take, and I think we'll talk a bit more about that later in the presentation and later linking to the questions that have been submitted. So I'll hand over now to Councillor Greene. I've given the high-level summary.
Thank you, Rachel, and can I add my thanks to the Chief Executives, to everybody who's taken the trouble this evening to tune in at the end of what I'm sure has been a really busy day. Now I've got about half a dozen slides, and I'm going to try and give you a bit of a whistle-stop tour of what it is that the Council has achieved so far, and a bit of horizon scanning for what we're looking to do either further into the future or actually over the next few weeks. Now, Graham mentioned the Together We Can programme, which was an arrangement which we stood up very quickly back in the spring. And this week, you may be aware that it's been redeployed to, along with council staff and many volunteers, to deliver emergency food parcels to ensure that hundreds of children don't go hungry over the half-term period. 467 food parcels currently, and that's over 200 families. And these went to parents who are in receipt of universal credit or otherwise in need. And if you look at that picture, that's while that wasn't my photograph, I was with the team this morning, and it's an absolute hive of activity, with a huge amount of food being put together and got out to people who really, really need it. And we'd urge people to contact the Together We Can helpline on 0300 123 7052 if they still are in need. Looking ahead, we're already planning our winter support, getting ready to stand up staff and services that are needed to support the most vulnerable again, working with our brilliant voluntary sector partners, and should we move to tiers 2 or 3 to plan for food parcels over Christmas for those who might be experiencing financial hardship. That same team have been in contact with about 800 people so far who've either tested positive or who've been in close contacts with positive cases. And at current levels, we have about 800 volunteers still ready and willing to go, but we always need more. So if you can, please do sign up via the Community Action website. Now, Rachel has mentioned care homes, and we're doing quite a lot of work getting ahead. It's quite normal, actually, for care homes and the health service to be putting together their winter readiness and infection control support at this time of year. And of our 158 care homes, and bearing in mind that about a third of those care for people with learning disabilities, autism or mental health. So we've got about 100 caring for older people, including those with dementia. This week we've put in place a new approach to hospital discharges to make sure that people are really making important decisions about any care they might need in their own home or close to home. And also we've been working with those hospitals to make sure that COVID positive people don't get discharged back into care settings. We have had some very positive responses recently from our care homes about their state of readiness. So we know that 96% of them are feeling confident about implementing infection and prevention and control measures, that they've really confident about the support that they're getting from the NHS, and they're taking up access to testing for both their residents and their staff, and that 100% of them have access to sufficient PPE and training, which was clearly a huge concern earlier in the year, but I think that's a very welcome picture. And just briefly to mention schools. There are daily updates being sent out to all head teachers with advice on home learning, social distancing, travel to school, and any advice, further advice that they need to help their pupils with their education. Homelessness was clearly a huge issue at the beginning of the pandemic. People were rightly concerned about people not having homes where they felt safe to be and where they needed to go in both bad weather and at a time where people were just beginning to understand how very vulnerable people living on the streets were. So we had a big push in March called Everyone In, and as a result we have far fewer homeless people now because many are still accommodated through that programme. Some have gone into hotels, but many have also moved on to longer term and more sustainable solutions. So currently the numbers that we find living on the streets is about 30, which is clearly 32 many, but it's about half the number compared with last winter. We do continue to work with our very specialist partner in St Mungo's, who have dedicated staff out on the streets every night, working with those who are sleeping rough to build their trust, to understand their needs and to offer help. Now, a normal part of the winter planning is something called the severe weather emergency provision, and that would normally mean that we would attempt to get people accommodated into temporary provision in periods of very low temperatures. We've had to approach that differently this year, so we can't be using the church halls that we might otherwise have done because of social distancing. But instead, we're working hard with those longer term agreements with a number of hotels, and of course the number of people to be accommodated are much smaller now. So this slide is a bit of a reminder of how the world used to be when we were much more confident and regular users of our high streets. So we've been working to respond to the impacts of COVID-19 and help our economy recover. We've got a dedicated team out and about helping businesses across the area to access the information they need to be able to stay open safely. We've already visited about 2,500, of whom about 86 are open for business. There are enforcement officers too, but enforcement is always a last resort. We would ask people to report businesses that aren't compliant on our website, but the number that we found to be non-compliant is really very low. We know that the lead up to Christmas should be a busy time for our high streets. Many businesses have been working really hard to be compliant with government rules, and last week we discovered our Rediscover Safely campaign, which is what the photograph is showing that you can see. And that's a campaign reminding people of all the things that they might have missed about their local high streets, whether it's a favourite cafe or a hidden gem of a shop. We really want people to be able to discover all the normal things, but safely. In tiers 2 and 3, retail remains open, so as long as we follow safety guidance, we would encourage people to continue to visit and support their local high streets. As Graham mentioned right at the very beginning, we're doing our very best to keep in touch with you and with other members of the public and our residents through the normal channels, as well as through a Trusted Voice programme, which is an initiative by Public Health Dorset trying to reach out at various communities. The universities are working to get their message out to our student population, and of course local councillors are being mobilised and have been distributing targeted information when needed. But please, if you can, follow us on social media or do sign up to our email news, and the link is right at the top of our website homepage. Our local magazine will be distributed to homes across the borough at the end of November. But please, please, those of you who are here tonight are digitally abled and you, I beg your pardon, enabled, but you will know, I'm sure, just as I do and council officers know, that not everybody is. And we would ask you, please, to help us spread the news, to help keep people informed. This is a very anxious time for a lot of people, and the more information that we can provide to our residents, the better their access to those services can be. So if you can, share with people what you've heard this evening, or you can download some information on the Together We Can website. So please, please tell the story. So we have a shared responsibility, all of us. This isn't about what the council does, this is what we can do all together. We're currently at tier 1, which is medium risk, but this is changing very quickly, as we've heard from Rachel. If the infection rates don't stabilise or indeed start to fall, especially in those older age groups, we're potentially putting increased pressure on our NHS and hospitals, and government at that stage will want to discuss our area moving into additional measures under its current 3-tier system. This would impact our economy and our well-being, but might be necessary to prevent further spread. The way to avoid those further measures is for all of us to follow the hands, face, space guidelines, to minimise contacts with those outside our households, and to work from home if we can. We must get tested as soon as possible if we have symptoms and self-isolate in accordance with test and trace advice. We have got new testing facilities, as Rachel has mentioned, on both the Talbot campus in Wallasdown and the Bournemouth University campus at Lansdowne, and those are available to all members of the public if you book the test through the national portal. That is the only point of access, and of course you only need to do that if you have symptoms of coronavirus. We are, though, concerned that not everybody is self-isolating properly. It's really important that if you've tested positive or been contacted by Test and Trace, that you follow their advice and isolate at home. No popping to the shops, not to work, and not outside for exercise. And household transmission really is a key issue for us locally. So please, please do all you can to try and keep separate from the person testing positive in your household, as it can spread so easily. Thank you.
Councillor Greene, thank you very much for that really comprehensive coverage from the council's perspective. I'd now like to pass over to Chief Inspector Wayne Nock to give us the Dorset policing perspective. Chief Inspector.
Thank you, Graham. So talking around what's being done on enforcement, I think everyone would agree that it's everyone's business to ensure that they respect the government guidance and of course try and prevent the spread of COVID. For businesses themselves, they are generally responsible for enforcing the regulations, and of course that's always been the case if problems occurred previously. But of course, if there is a report of something accompanied by, for example, a large number of people gathered or people's safety is at risk, then we would absolutely expect the business to call the police and we would respond and provide assistance. So we want to be really clear that hasn't changed. If there's something else other than it's just a problem that the business can deal with themselves, then the police will of course assist. I'd like to make it clear there's been a really consistent national approach as far as the police have had, and we've adopted what we call the 4 E's. Our approach is encouragement, engagement, education and enforcement, and the enforcement is a final option. It's not our preferred option, and of course that can be used as and when required. It's a flexible tool. And we do accept that some regulations, such as the Rule of 6, are relatively straightforward. When we get into some of the higher tiers, there is some more complexity. And of course, police will always adopt a proportionate response, as I've mentioned before. We want our communities to feel safe and protected, so we are continuously working with our partners to try and reduce the risk of the pandemic. We can issue fixed penalty fines, and we will do to those that refuse to change their behaviour if they haven't engaged with us, as I mentioned earlier, with the 4 E's. For example, during the summer months, we used some enforcement powers that we have on dispersal orders on a number of occasions, and this supported our council colleagues, particularly when we had to manage those issues of the large numbers of people that were visiting the town and the beaches. And what these do is direct a person to leave an identified area for a specific time period, and they would actually commit an offence then if they failed to comply with that direction. I'd like to just point out the police have been continuously working with our colleagues in the Bournemouth and Christchurch and Port Council. We've been doing some joint training for those engaged in COVID-related enforcement, and over this coming weekend there will be some joint patrols in the BCP area. Our colleagues from environmental health, for example, can contact police directly, and that ensures that we can support them when they're dealing with things like noisy parties, particularly when they're faced with more than 6 people gathered together. Would like to reiterate that if you do see something that concerns you, consider whether it's a matter for the police or for one of our partner agencies, but in any case, you can report online via the Dorset Police website, or you can use 101. We would prefer online, but you can call us on 101. And I can reassure you that we continue to look at all our calls, and we assess them through a threat, risk and harm vulnerability matrix. And it's the vulnerable that we would always seek to protect, obviously in the first instance. We've got to prioritise incidents, of course, and we use those threat, risk and harm matrices to do that. But everything that is reported from yourselves does get recorded, and it really contributes to us building up that up-to-date intelligence picture, which means that we can identify perhaps patterns or repeat problems, which then help us to then proactively target where those problems are occurring. So please don't think that just because you don't see a response that it's been ignored, because it certainly hasn't. All I would say in conclusion is that we've had some latest crime figures come through, and that Dorset Police actually has seen a 5.1% drop in recorded crime. And these were new figures by the Office of National Statistics released yesterday. And that equates to a reduction of 3.6 crimes per 1,000 population. We totally accept there's a lot more to do, but I think this demonstrates some of the excellent work that is done by our police officers, our staff and our partners, and of course within our communities, to try and keep people safe in what has been a very difficult period. I think I'll hand back to Graham now. Thank you.
Okay, thanks very much. So we've had a bit of a run through the services and the responses provided by the council, but the public health position and from the police. What you can see, I hope, is this is genuinely a multi-agency response to the global pandemic, and we're all working very closely together. We've had a number of questions from members of the public, and I thought we would just try and deal with those in relatively short space of time. So we've covered many of the key issues already, but the first question that we've had is one on social distancing. So Councillor Greene, if I can ask you to pick this one up to start with. The question is, what's being done to make sure people are social distancing in busy areas like parks, town centres and the promenade? Councillor Greene.
Thank you, Graham. It seems a long time ago that there were sunny days, but we will have them again. And of course, back in the summer, we developed in very short time the BCP beach check to help people to avoid busy areas, and that was, I think, very well received. Currently, we've got a hotspots email address for reporting issues, and each report will be investigated and followed up. Now, this weekend, we're launching our COVID Marshals scheme, and that's obviously part of the government scheme, but that will be 7 officers working locally to support compliance and social distancing, working alongside other agencies, including and especially the police, to provide that visible presence in priority areas and hotspots. They'll signpost businesses and residents to advice and guidance. They will undertake some spot checks, and they'll refer information to regulatory service if needed. They'll be wearing high-vis jackets. They won't be dressed as pumpkins this weekend, and they will be highlighting their roles as COVID marshals. And just as the next slide will show some examples of our signage in the town centres. I hope that's with you now, and that's just about focusing on encouraging safe behaviours such as hands, face, space, and being kind and considerate to others when out and about.
Okay, thanks very much. The second question that we've had is sort of leading on from that, really. It goes on to enforcement. So Chief Inspector Ron, if I can ask you to pick this up, but the question is, so what's being done on enforcement for businesses not complying with the rules, or for members of the public not following the rule of 6, and how do people report issues like illegal gatherings or businesses that appear not to be compliant?
Thanks, Graham. So I've clearly answered most of those questions already when I spoke probably a bit too much at the start, so apologies for that, but it was effectively, of course, it's businesses' responsibility, as I said, for them to manage their own premises. But if there is something accompanying a problem i.e. too many people in one place at one time that they're not able to deal with, they feel at risk, that there's a safety issue, then of course they should report to us and we will then assist. But it is down to the businesses themselves to manage and try and deal with that rule of 6. But we totally appreciate some of the difficulties in enforcing that, which is why I understand that it's not always an easy thing to achieve.
No, thanks very much. It's clearly a difficult balance, and the local authority also has some remit to issue, for example, fixed penalty notices and do enforcement action. So I think it's quite interesting to see how we're working together between local authority and police to look at who is best placed to do this enforcement. And again, we tend to use it as engage, explain, encourage, enforce, hopefully leaving enforcement to the very last. Okay, that's really helpful, thanks. The third question, Rachel, you'll be pleased to hear, is one for public health. So it's really about self-isolating. So who investigates cases where people are not self-isolating after they've tested positive or if they've been identified as a close contact? And a common question again is, who should people report breaches of self-isolation to? So, Rachel.
Yes, well, self-isolation in particular is absolutely one of the really important tools that we have at this point in time. So from a public health perspective, this is one of the really important messages that we continue to try and communicate about the importance of doing so. So if you do develop symptoms, then you should self-isolate along with your household and get a test as soon as possible. That is by far one of the most effective ways that we have as a community and globally to respond to COVID and reduce the onward transmission. This virus is very easy to transmit, so hence the importance why we are all stressing it very often about the importance of self-isolation. The really important thing to note is that the vast majority of people are self-isolating, and they absolutely are sticking and staying at home and trying to reduce that contact. Completely recognise that can be very challenging for some people. There's government grants that have been put in place as well to try and help support people, particularly those that are on low incomes. And locally, earlier Councillor Greene talked about this Together We Can and welfare checks that are happening. So we have over the last few weeks been instituting a call to all of those people that have tested positive and need to self-isolate, and to have a welfare call to check up and see if there's any more support that's needed to help them self-isolate effectively, which feels like a really positive development, and it's been received very well from people that have received it. So yeah, that's we're trying probably all of the E's that we've been talking about earlier in the presentation to encourage and enable and educate about the importance of self-isolating. In terms of who should breaches of self-isolation be reported to, again, I think it goes back to Chief Inspector Wayne Nock's point around if there is a clear situation where somebody is flagrantly disregarding that, then making contact through the police website. And we have now got a weekly meeting where the agencies get together to review if there are any themes or patterns to again try and resolve that and put in mitigations and support. So I think that picks up a theme that's developing.
Thanks, Richard. That is really helpful, and I think the focus on all of our behaviours, we all need to respond. And even if it's just from washing your hands, the hands, face messages, right the way through to responding when we are asked to self-isolate. The next question, Rachel, is also for you, and it's sort of moving it up a notch really. So it's questions about Tier 2. So what is the criteria for being moved up to Tier 2? Why haven't BCP area moved to Tier 2 yet? Would a change in restrictions, if we did do that, only apply to the Bournemouth, Christchurch and Poole area, or would neighbouring areas be included? So just tell us a bit about that, and then you may want to bring Councillor Greene in as well on that one.
Thank you. Yes, there's been a lot of discussion and actually communication coming in through a variety of routes about the question of Tier 2. So just for everyone's awareness, we are currently in medium, so currently Tier 1, as is the rest of the South West. talking about the criteria, there's much talk about the infection rate being the criteria, but actually it's a very complicated and multifaceted set of criteria, and it's evolving very rapidly as the situation nationally is evolving. So it's an ongoing discussion. I think what's really important to know, and for residents to know, is that this is something that we are in discussion with Region and with the chief execs around what the options are for us, and keeping an eye on our situation, what's going on in terms of our case rates, and a whole range of other measures, including hospital admissions, etc., to really identify what other tools we have, what other options we have. This may be one of them, but it would very much be a consultation and discussion. We'd want to take a really considered approach to this, and ultimately it will be a discussion between local authorities and the central government. In terms of change of restrictions only apply to BCP area or neighbouring areas, again, that's very much would be open to discussion and consultation around the benefits and the risks. I mean, there's very clear recognition that we have very strong connections with our neighbours in Dorset Council area. Lots of residents live and work in both local authority areas, and administrative boundaries don't really impact a huge amount on people's lives. So there's that element to consider, but again, it will be part of that ongoing discussion and debate. So the answer is that it to be reviewed to what makes sense given the situation we face, but a huge amount of cross-border collaboration, both with Dorset neighbours, but also other areas out of our region. So in terms of how we bring in the virus under control, I fear I could spend an awful lot of time talking about that, and I think there's been some really, really good illustrations of that earlier in the presentations from colleagues, and I just again want to reiterate how much this is a multi-agency and linking with our communities, our residents, you guys, the community sector. There's so much work that's gone on, really inspiring stuff. It's quite an enormous amount that's been achieved, but it's going to take an awful lot more hard work and commitment and partnership and engagement from all of us to continue to work against this. As you can see by the figures, we've got a significant challenge, and we need to keep working and redoubling our efforts. In terms of the structured approach, as part of the government national framework, we produced a local outbreak management plan for BCP, which very much was the proactive work and preventative work, and working with our key sectors around how to prepare for COVID, how to respond. So prepare, prevent, and then if there was a COVID outbreak, how to respond effectively. And the work that's gone on across sectors, including with colleagues in school settings, care settings we've talked about, health colleagues, really, really important to note there's been significant success and a lot of good shared learning about how to effectively respond when we do have outbreaks in those key high-risk settings. We have got universities, we've got young people in BCP area, and there's been really good proactive work with the university, for example, and further education colleges around ongoing responses and preparation and messaging. So it really is a sense of everyone pulling together. Probably the most recent developments is noting that there's been such an increase in the number of cases coming through. We've been looking at doing more targeted comms, and particularly really local communication, certainly in areas that are affected or cohorts that are particularly seeing higher rates. And again, supporting the development of a coordinated approach around enforcement and engagement, and supporting businesses and individuals to comply. I think Councillor Greene probably has some really good examples of some of the messages that we've increased. So we've moved to an Amber Alert to really illustrate, and as part of our ongoing communication with residents, to be as transparent as possible. and illustrate quite why it's so important to stick to the rules around social distancing and hand washing, and not meeting in great numbers of people greater than 6. We're not saying this to spoil fun. This is absolutely a significant and important situation that we're in now in terms of infection rates, and we want to be as explicit as possible with residents and friends and family and everyone that we're working with around the need to do so. So I think Councillor Greene is going to show an example of the updated communication.
Yes, thank you, Rachel. We on that slide, that's brilliant. Thank you. I hope while this exact slide might not be familiar to everyone, I think that "do it for Bournemouth, Christchurch and Poole, do it for your mates, do it for your family" message is probably quite widely known, and I hope quite widely spread, and resonates as well, because it is clear that it impacts on the people that we most care about. So we're currently at the amber, the medium level, and you'll see that you know, in many formats and on outdoor advertising spaces. And this is because we cannot stress strongly enough the need to follow advice. Whilst currently we are not in Tier 2, there's nothing to stop people choosing to minimise their contact with other households. Bearing in mind the comments that Rachel made about where we're seeing the greatest number of cases coming from, and that is the key restriction in Tier 2. And the best way to avoid spreading the virus, whichever tier we're in, is to avoid contact with others and follow the face-to-face guidance. Thank you.
Okay, thanks very much, Nicola. Next question is another public health one, which is Rachel. So can you share where cases are so people can make their own judgment about what action they might take, and are there any particular clusters driving the cases up, or is it widely spread across the community? And specifically, I think people want to know, are the cases that are getting really related to schools and particularly universities?
Thank you. Yes, again, as part of trying to be as transparent as possible, there's an awful lot of information and sharing of data around cases and number of cases, and also on the government website there's the local mapping function where you could see, just a word of warning, that is cumulative, so that is the total amount over the course of the pandemic. So there are lots of tools around, and I know the BBC have a postcode tracker that you can put in. So there is lots of information available. I think what we're really keen to be clear on is that the key issues remain the same, irrespective of location. You know, that not particular issues. It's about how we all behave. So again, stressing the importance of keeping social distancing, not meeting in groups greater than 6, and that is borne out in our cases and transmission. I already mentioned that the lion's share of increasing cases is seen through household contact and contacts with friends and family, and some small linked to workplace settings or particular settings such as healthcare or social care settings. So we are really watching that and sharing as much as possible in terms of data to be quite clear with our residents quite what's going on. In terms of the particular clusters, again, there are outbreaks linked to settings. In terms of the linking it to schools and universities, BCP clearly have got a lot of young people, and we have got several higher education settings. We have seen a number of cases associated with the universities, but that's not the whole picture. There are significant numbers of people in that younger age group, 18 to 30, that are testing positive, and that is by far where the bulk of our positive cases are, that age group. We've also seen a significant number of cases associated with school settings, but not in large numbers. And again, I want to pay testament to the hard work of colleagues within the education sector who are responding so effectively there's a real collaborative approach about really mitigating risks, and all of the work that schools have done to prepare and operate safely, I think is really coming into fruition. So yeah, it's not just that, but again, we continually are reviewing where our exposures, or what are the patterns of cases, to see if there are any lessons to learn or things to learn from outbreaks. So yeah, it's an ongoing evolving picture. And although over the last week there has been a slight increase in the number of cases seen in older age groups, and that is absolutely why we continue to reflect and continue to push messages that we really do need to take this seriously in our area.
Okay, that's really helpful, thanks. And Rachel, I'm sure you're pleased to hear the next three questions really head towards Councillor Greene and the Councillor's actions. And these are really on three parts of the community, or three segments. So Councillor Greene, the first one is, what's being done to support the tourism sector? So something really specific about the Bournemouth, Christchurch and Poole area that might feel different from the rest of the country. So yeah, what's being done to support the tourism sector?
Thank you, Graham. Yes, this is a really vital part of our economy. You know, large number of jobs and prosperity depend upon tourism. Never mind the benefits that it provides to all of us who, you know, enjoy living in this lovely part of the world. So we've been working with Visit Britain to promote the area as a safe place to visit. Nationally, Visit Britain developed a We're Good to Go scheme, which provided a checklist for businesses to help them be compliant and give confidence to visitors that it is safe to visit. It's the official UK mark to signify that tourism has worked hard to follow COVID-19 guidelines to maintain cleanliness and to aid social distancing. We've been advising and supporting businesses, helping them to be compliant, as we've spoken about before, so that we can continue to offer that brilliant experience to those choosing to visit. The 10 PM curfew is being widely complied with, and we really thank those restaurants and bars for doing their bit to help keep people safe. We're not seeing community transmission in our area where people are contracting the virus from people they don't know. And so whilst the rising cases are a concern, there's not much evidence that, well, in fact, there's no evidence that those visiting our area are impacting on our infection rates. Our tourism team's finalising the campaign to encourage visitors back next year to our area, and we really hope that the staycation market will be left booming after COVID, and we know that there is no better place for a holiday, and yes, holiday is a word, than Bournemouth, Christchurch and Poole. Thank you.
Thanks very much. Then the next question moves on to the education sector. Two questions really. One is, would the council consider a rota-based system for schools to operate to improve social distancing, trying to curb the spread amongst young people? And then what is being done to reduce the spread of the virus amongst students?
Yeah, thank you, Graham. This is a really important sector. Schools in BCP have remained open since March for vulnerable and key worker children, and as such we're in a really excellent position to open more widely to all students when pupils resume their learning in their school buildings. There's been a COVID risk assessment, processes and procedures that school leaders supported by Public Health and BCP Council have put in place in their schools, and they have been robust. The occurrences which we have seen in education settings have been linked, and there is a theme here, to household transmissions, and actions undertaken by schools and colleges have meant that the outbreaks and the onward transmission in educational settings have been minimal. This is real testament to the hard work undertaken by school leaders in making their settings COVID safe, along with the children and their families who have played an enormous part. In specific reference to the question, with the COVID secure measures in place, school leaders haven't had to move to a rota system. The BCP education system remains agile in its approach to responding to cases in school settings, and school leaders, who are supported by the Council and Public Health, will continue to review delivery models and risk assessments to keep children and their staff safe, whilst delivering a quality learning offer. And we know that children have a fair amount of catching up to do, whether that's in school settings or remotely. We're also working closely, as Rachel has mentioned, with the universities to share information and messages. They've detailed information on their websites about the measures that they've put in.
Thanks. That's really helpful, and certainly on some of the national calls I've been on, the discussion around schools in particular is generally that the schools themselves have got really good COVID controls within the schools, it's the social interactions that take place amongst the school students, school pupils, outside of the schools, and parents. So it really is interesting the position of schools within that discussion. The next area is moving on to vulnerable people, and Rachel, so I may have lugged you into a false sense of security on this one, so I was going to come to you first on this. So the question is, what's being done to protect and support people who are clinically vulnerable during this latest wave of infections? And I thought you might want to tell us something about the National Shielding Programme, and then perhaps Nicola could talk about what the Council is doing at the moment.
Yes, thank you. In terms of the national scheme that we saw in the first wave, there is no change in government policy at the moment. There isn't a rollout of the shielding programme as it officially was a few months ago. However, I think what's really important is there's a whole range of work that we're doing locally to support both clinically vulnerable, but also other vulnerable groups that we know are more at risk from either exposure to COVID-19. But really putting it bluntly, it's absolutely about that importance of protection and reducing social contact and following the rules and supporting people to be able to do that safely. I think Councillor Greene's picked up on lots of the really positive work that's been going on earlier in the presentation around the welfare calls and also Together We Can. But perhaps I should hand over to Councillor Greene to pick up more.
Thank you, Rachel. I'm going to finish where I started, which is with a shameless plug for Together We Can. The helpline is still there and it's available to people who were previously in the shielding group who need the support or who are feeling isolated. Please do call that 0300 123 70 52 and our staff will assist in any way that they can. The community development team are also there reaching out to communities on the ground and they're mobilising this fantastic resource of volunteers wherever needed. So on that note, Wayne, I'm sure you've got something to say about vulnerable people.
Thank you, Councillor. I just think it would be remiss of me not to just say that protecting people at risk of harm is one of Dorset Police's key priorities. And I think it's worth saying a big thank you to Rachel and her colleagues in public health who have done fantastic work all the way back from when this all started. Our colleagues in BCP and Dorset Council. One of our primary aims as a police force has been to assist and protect the health service. And I know that's along with the many other statutory organisations. And we've just want to reassure you all that we've been working continually together now, sharing information, agreeing joint working processes, and really doing our best as a local collective from all the organisations represented to achieve this aim. So I just think it's really important that you know that there's so much work going on in the background where all these relevant agencies are talking and helping each other. So I just wanted to make that point, but thank you.
Okay, thanks very much. I'd really like to thank our three presenters today. Just by way of sort of closing remarks, we are in the middle of a global pandemic, the like of which we've not seen for many, many years, probably a century or so. The public sector has tried to respond to that as best we can. I think it is important that we emphasise that nobody has had to deal with this sort of ongoing emergency situation in any of our careers. Very often emergencies are very time limited, they're short and focused, short and sharp when you move into recovery. We are still dealing with a growing pandemic and growing infection rates now in this second wave. I hope that what we've done is reassured you, if you're listening and watching, that we're reassured that we're doing everything that we can to support local communities and really help control the infection rate and the transmission rates within Bournemouth, Christchurch and Poole, and that you have a council, a public health service and a police force that are really working to that effect. The council's vision statement is to create vibrant communities with outstanding quality of life where everybody plays an active role. We can't do that, we can't achieve that unless we really get to grips with the pandemic, control the virus as best we can so that people really follow the hands, face, space messages by washing your hands, covering face wherever appropriate and leaving appropriate distancing, social distancing, so that we control transmission throughout the community. That way we will beat the pandemic and achieve our vision and really support the communities and the businesses across the Bournemouth, Christchurch and Poole area. So thank you very much, Chief Inspector. Not very helpful contribution. Rachel Partridge, Deputy Director of Public Health, and Councillor Nicola Greene, portfolio holder for COVID and related issues within BCP Council. Can I also just thank Kirsty Hillier, who's been maintaining the technical support behind the scenes, and as far as I can tell, has had the right slide on and the right camera shots at the right time. Thank you very much. If you have any further inquiries, please, as Councillor Greene said, sign up to the Council's newsletter. We will communicate as widely as we can, and it'd be good to hear some messages back from the community about what you're doing as well. So thank you very much to the presenters, and thank you all for watching and listening.